All right. Hello, everyone. Thank you for joining today's live. This is for November 3rd, 2025 in America, November 4th here in Australia. Thank you all for coming down. Want to say just a quick thing. This whole thing about carbohydrates coming through, like people adding in carbs, you need carbs. No, you don't need carbs. I'm having some videos come out on the subject, but just to do a quick reiteration. You don't need carbs. There's no such thing as an essential carbohydrate. This is actually well accepted in the scientific and medical community. The National Academies of Science and Institutes of Medicine have actually made public statements saying that the amount of carbohydrates that you need for the entirety of your life to be in good health is zero. And that there are entire populations that don't have any carbohydrates their entire life, or very low, but some none. And they actually don't see any negative health effects or negative effects on longevity by not including carbs ever. So that is just not seen. And there are randomized controlled trials with long-term ketogenic diet that show no dysfunction and no deleterious health effects, no spikes in their cortisol, and no drop in their thyroid. So when people say that, they are making it up flat out. That is not in the evidence. That is not what the evidence shows. And that is not the biochemistry. And I have videos coming out that we'll talk about that. And I've had other lives and other things like that where I talk about that as well. So the other thing is there's sort of two definitive points of evidence to know that we as humans are not designed to eat carbohydrates at all. Major one is insulin. We have a specific kind of insulin, and it matches a specific arc of blood sugar, etc. When we eat carbohydrates, we get this big spike in blood sugar and a spike of insulin, and then insulin stays up longer. It's a longer curve, and that actually forces blood sugar to go down too low. And so you get hypoglycemia, reactive hypoglycemia. So your body gets too low, and now you have to go eat carbs to chase that, and carbs and chase that. And so you have the spikes and ups and downs in blood sugar and insulin. It's just all over the place, right? When we see, and so in diabetics, we actually can't use normal insulin, right? The normal insulin, like our insulin. So that's like the insulin that our body makes. We don't use that in diabetics because it doesn't match the carb curve properly. So we've had to reinvent insulin and make things like Act Rapid and Nova Rapid that have a bigger spike and come down, so it matches that carb spike and more appropriately. So it doesn't stay up for longer and then it drives you down way too low. So you're getting like hypoglycemic and things like that. So it's actually doing a bigger spike and quicker, right? So that's matching that carb curve. So we had to reinvent insulin because our insulin doesn't work for carbs very well. Okay. Type 1 diabetics are now figuring out that you can do a ketogenic diet and a lower carb diet, or even a full ketogenic diet, or even a carnivore diet, and that can actually get much better blood sugar control and much less demand for insulin. But what they're finding out is that they don't use the Act Rapid. They can't use the Act Rapid because that doesn't match the protein curve. So what they're doing is they're going back to the R insulin, the regular insulin, our normal insulin that your body is supposed to make, and that perfectly matches the curve of protein. So our insulin biologically is designed for protein, not carbohydrates. We don't have insulin for carbohydrates. We have insulin for protein, and that matches that protein curve. So that's pretty damning evidence that we are not designed to eat carbohydrates. The other thing is our teeth, our dentition. People notice when they go carnivore that they don't actually get cavities anymore. And that their oral health is much healthier. Your oral health is a window to your overall health, especially your cardiovascular health. There's a strong correlation between oral health and your cardiovascular health. Animals in the wild don't have dentists. They don't have Listerine where they can disinfect their mouth all the time. Dentists now are like painting kids' teeth with iodine to like just completely disinfect it, like a surgical site, because these bacteria are just destroying our teeth. If your teeth get destroyed in the wild, you die because you can't eat. And so koalas, when they're eating eucalyptus, they actually wear down their teeth because they're not rodents. They're not keep regrowing their teeth. And eventually their teeth wear out and they die of starvation. They can't eat anymore. So if your teeth are rotting out, then you'll die even quicker. So any food that causes your teeth to rot is 100% not your biologically appropriate diet, flat out, for any animal. So any animal that gets rotting teeth from eating X is not their appropriate diet. So dogs and cats getting rotting teeth, that garbage is not for them. Us eating this stuff, rotting our teeth, that is not designed for us. And it's the carbohydrates that actually propagate the bacteria that make carbohydrates. Sorry, sorry, I misspoke. So eating carbohydrates breeds for the bacteria that cause cavities. So the things that eat carbohydrates in our mouth, the bacteria that like the carbohydrates from what we're eating, are the ones that cause cavities in our mouth. And so eating carbohydrates causes our teeth to rot because that is breeding for the bacteria that rot our teeth. So that's another very strong piece of evidence to show that we're not actually designed for carbohydrates, because whatever we're designed to eat, it was designed to eat without the benefit of dentists, right? So our teeth should last. So pre-agriculture, big, beautiful, perfect teeth, no cavities, no missing teeth. Typically, I found that there's just like these, great examples of dental health immediately after agriculture. It didn't take hundreds of years or thousands of years. It was right then with agriculture. Jaws became smaller, teeth became crooked, and also had a lot of cavities and tooth decay and missing teeth as well. So that is very, very clear evidence that we are not designed to eat carbohydrates. And the evidence is strictly against ketosis being harmful, or that we need to include carbohydrates. So now whenever you see someone arguing these things, now you know a lot more than they do. And you can call them out for what they're doing, which is nonsense. Even if they don't want to do it, or they feel that they feel better with carbohydrates, trying to scare people off and saying that you are all going to get hurt by being in ketosis is absolutely ridiculous. And it's completely against what's going on. There are tens of millions of people that are having no issues at all. So why are they saying, well, I saw this one person or 1,000 people that had problems? Well, first of all, it doesn't mean that it's ketosis. In fact, I would argue that it's not. And then you can find 100 other reasons why they might be having those issues. But that's 1,000 people compared to 10 million people who are not having any problems whatsoever. So why are you trying to scare them off? And why are you trying to scare off other people who are coming to this and thinking about this because they have very serious health issues, or diabetes, or autoimmunity, or something else, and they're in trouble? And this might be the only thing that saves their life. And there are a lot of people that has saved their life. So I take this very personally, because I've just seen people get so helped by it. And I've never seen anybody hurt by it ever. There can be people that are having health issues, but when you work with them and you teach through and you look into things closer, I've always been able to find something that can be tweaked that then makes things better every time. And because I work on the assumption that there is something, because if this is our biologically appropriate diet, it should be right for everyone. I mean, you're not going to find lions that just need carbs. You're just not. And I think that's the same for us too. So it wouldn't make sense otherwise. And so I work on that presumption that there is something that we can find. And so I look for it, and I don't stop looking for it until I find it. And so I find things more often than other people do. So just something to think about. And more than anything, if you're thriving and you're doing great doing this, who cares what anybody has to say? Oh, your thyroid and this, that. If you're not having problems, then that doesn't apply to you. So, just some ammo for you guys going forward. Okay, there's a question here that was sort of left over from another live I did with Anita at Anita's premiere, or not a live, but at the premiere I did with Anita. And so someone asked a question, did a super chat then. Unfortunately, I haven't been able to answer it yet, but it's from Gary Michael Scott, who says, hi, doctor, I have herniations between L4-5 and L5-S1, severe stenosis at L5-S1, 2 months of PT and small improvements, but some sessions overdo it. Given gabapentin and baclofen, they want steroid epidural, should I need guidance? So unfortunately, I can't give direct medical advice over the internet. And then this would definitely be be that. But you have to sort of weigh the pros and cons. We do epidural steroid shots for people quite often. It can help with pain. It's typically limited because it will sort of wear off eventually. But it depends on what the stenosis is coming from, like the herniation. So if you have disc herniations and you do sort of injections, a lot of these herniations, if they're an acute herniation, quite often they can heal on their own, or at least they have a chance to. And so what things like gabapentin or epidural steroid injections or nerve root sleeve injections or things like that, depending on what the issue is. One thing that those can do is they can just reduce the inflammation, help with your symptoms at the time, and give your body a chance to heal. And sometimes you give these injections and it allows your body for a couple months to heal and get better. And then you don't need anything after that. You don't need surgery, which would be great. Another thing is that sometimes when you do the injection, like let's say it's compressing on like a nerve root that's coming out of your spine, and you inject that area, I mean, you see on MRI, this is inflamed, this is pissed off, and you inject it and it sort of calms down, your symptoms go away. Well, that can be therapeutic, but it can also be diagnostic, because if you do that injection and it works and it helps, maybe that your body heals and the disc sort of calms down and scars down and relieves that pressure by the time the steroids wear off. But if it doesn't and it comes back and the pain comes back, that's actually a good sign that surgery would actually be helpful. Like doing a surgical decompression could actually give you long-term benefits. So there's a cost benefit analysis. When you're doing a lot of steroid injections, it can increase scar tissue. It has risks, of other sorts of things that your doctor can and should tell you about. From a surgeon's perspective, sometimes when people have gotten a lot of injections, it just makes the tissue a bit more sticky and tough. So it's a more difficult dissection, getting down to the area that you want. But it's not the end of the world. We operate on people with lots of scar tissue all the time, and so it just increases the difficulty of it to a degree, and so slightly increases complication rate from surgeries. If you're doing carnivore, which I assume you would be if you're in these chats, and if you're not, you should, that might help. I mean, I've seen a lot of people improve neurological issues and reduce inflammation and help their body heal from doing that. Glycation, high blood sugar, damages discs, and we see this in removed discs, that they're full of that glycation. And same with damaged joints and arthritic joints and things like that. So and so that the damage is already done for you, but at the same time, being ketogenic and getting out all the carbs and getting out all the junk and everything like that can help with inflammation, help reduce inflammation, help improve your situation, but also help prevent further damage from happening. So that if you're preventing further damage, it actually gives your body a better chance to overcome the damage that you have now. So that's just general advice. I can't say what's going to be best for you in your situation, but at least you have a bit more information and things that you maybe think about and try, and then talk to your doctor about what would be best for you. And good luck with that. Hopefully that settles down and you feel better. Okay, we have a super chat from Berliner624. Thank you very much for the super chat. I'm not seeing. Oh, there we go. So there's a question down below that. It says, hi, Dr. C. I've been carnivore for almost 2 years now with great benefits. That's really good. Thank you for your support. You're very welcome. I still feel weak often and have sore muscles after workouts. My tonsils look crazy. Would removing them make sense? Well, it just depends. I mean, I like keeping, my body intact as much as possible. But if you're getting recurrent infections, then it's affecting your breathing and other sorts of, there are reasons for getting that out. But, I would definitely talk to your doctor about, would this be appropriate? I mean, if you can avoid it, I would. Basically, and you want to avoid any surgery as much as you can. You want to keep your body as intact as you can. But there's sometimes, these things need to come out. But unless they're causing a lot of problems, probably best to keep this in your face. But again, I can't give you direct medical advice because I'm not seeing you as a patient, and I don't know the full story. So I can't really answer that, unfortunately. But that's something that generally, if you can avoid surgery, it's good to avoid surgery. But something to take up with your doctor anyway. As far as the sore muscles after workouts, that suggests there's probably something still in your diet that's causing that inflammation. So that's usually things like coffee or tea, which can absolutely cause inflammation, or maybe dairy. These sorts of things can increase soreness. Yesterday I hadn't been in the gym in, God, I don't even know, weeks anyway, month or more. And I think I did like over 20 sets of chest. Went crazy on chest. I'm not sore. I don't even feel it at all. I sort of moving around. It's sort of like, oh, okay, yeah, something happened, but it's not sore, right? But I am very pure, just meat and water, nothing else. Meat, eggs, and water. That's it. So generally, if you do get that soreness, it's because there's something else getting in. Now, if you're only eating meat and only drinking water, maybe there's something else in your environment that's sort of triggering that off, or maybe you're a bit unwell. If your tonsils are inflamed, maybe you have a sort of a background infection that's causing that sort of thing as well. But think about if there's anything else getting it, even spices and seasonings. I had some beef sticks, some like South African dried beef sticks, and they had some spices in it. And they tasted good, but I was sore the next day after a leg workout. And I was like, was that really the seasonings? Like normally it comes from something like grains, if like a bit of rice or beans that got mixed into a meal while I was out or something like that. That happened years ago. And I was, sore for a while, or a cup of coffee or something like that. But this was just spices. So I was like, okay. So I tried having, a few more of them, and like massively increased the pain and stiffness. And it lasted like 4 days. And so I was like, well, yep, never doing that again. And so little things, pepper could potentially be causing an issue too. So, just be mindful of that. As far as feeling, you say you still feel weak often. Okay, so if it's intermittent, if it comes and goes, there might be something that you're adding in during that time that's sort of setting you back. There is an adaptation period. You're well through that after 2 years, but you could be sort of going back and forth if you're adding in little things here and there. And that could be setting you back, or it could be you're not eating enough or not eating enough fat. Keep a journal, keep a diary. This is what I was talking about earlier. Like there's usually something that you can find when someone has an issue. And one of the best tools for this is using a journal. If you're having particular symptoms, you just write down everything that you eat every day. You write down how you're feeling and all these sorts of things. And then you start looking for associations. And it may be that you don't find any, in which case it's not the food, is it? It's something else. And so you want to look down that track. So it's good information either way. And sometimes you can see like, oh shoot, every time I sort of have a coffee, this happens. And every time I have this happens. And then you say like, and then you have good evidence for like, okay, I just need to cut that stuff out. So that's what I would suggest anyway. Okay, is a super chat from Christian Wiesp, maybe? Thank you very much for the super chat. Christian says, hello, no hunger or craving of salt. If I salt, I can eat more. Why is this? Also, does water compete with fat for hydration? I'm never thirsty, can feel sick drinking. Well, just drink water as thirst demands. That's fine. When you're in ketosis, for every kilo of fat that you burn, you will produce 1.1 liters of deuterium-free water. So you don't necessarily need as much. Also, because things are going in your colon and they're, and you actually want to desiccate them and dry them out, and it's the fat that's actually keeping things soft. You don't need to basically drink. You're not going to lose as much water in your stools, and so you're actually going to retain more water as well. Also, when you're not using a lot of salt, your body doesn't have to excrete the excess salt, so you don't need, and water follows sodium. So you won't have that either. So there are reasons why you may not need as much water as other people. Like I don't, as I reduce my salt and now sort of basically don't use salt anymore, I'm not as thirsty. I don't drink as much water and things like that. I still drink a lot of water though. I like water, but not nearly as much as I would otherwise necessarily. So as far as salt, that's one critique that some people have about salt, is that you add that, it's like MSG, it just sort of makes it taste better anyway. And so you have that hunger signal saying, oh yes, this is good, I should have this, even after your body may not actually need or want it. But maybe your body wants a little bit of salt. And so you put that on there, your body's saying, oh yes, salt would be nice. So, as long as you're doing well, and you're not having, you're putting on excess weight or doing this or doing that, I just sort of listen to your body and eat what tastes good and drink the water as it's as you're thirsty. Try drinking water, and if it's nice and enjoyable, then that's fine. If it's sort of making you sick and you don't want, that's fine. Just don't. That's fine. You'll retain more water, and you will make some water by being in ketosis. You will almost certainly need some external water as well. But less potentially, especially if you're not having as much salt. So, yeah. Okay. So next question is a super chat from looks like Circuit 7. Thank you very much for the super chat. I really appreciate it. So they say, I'm a 31-year-old male, 5'6", 200 pounds, aiming to lose about 50 pounds and build muscle. Calorie calculators say 2,300 per day, but I'm barely over 1,000. I'm worried how much energy and I'm worried about low energy and rapid weight loss. I can't afford that much meat. What do you suggest? So if you're only sort of getting 1,000 calories a day because you can't afford to eat more, then yeah, that's a problem. You need to sort of figure out cheaper cuts of meat. Ground beef brisket is very cheap. It's not that much, and it's nice and fatty. Any cut of beef is exactly as nutritious as any other cut of beef, as long as it has this similar amount of fat. So just get whatever you can afford, and you can even cut brisket up into steaks. You don't have to slow cook it and things like that, although slow cooking it is nice. I know people that cut it against the grain and sort of have that sort of cut it against the grain, brisket against the grain, and actually cook it up as steaks. So that's something that you can try as well. Chicken is less expensive. The dark meat, the thighs and the drumsticks with the skin on, are typically the cheapest part as well. And those are the best parts because those have the most fat. Pork can be very cheap. Pork shoulder is sometimes about $2 a pound. And so you can get a whole bunch of that, put that in a slow cooker, crock pot, or a pressure cooker, and you get amazing fatty pulled pork. And then, that'll feed you for the week. I mean, there are cheaper ways of doing this, but if you're barely over 1,000 because of affordability, then there are other options. If you are barely over 1,000 because your body just doesn't want it and is just saying no, stop eating, I would still just listen to your body. You eat fatty meat until it stops tasting good. And you do that as many times during the day as your body's telling you. Typically, when you're losing weight or you have weight to lose, your body will prioritize that, and it won't need you to bring in as much food. So your hunger signals will be less. Now that may not be apparent right now, but when people get down to a lean body mass that their body's happy with, typically their appetite increases significantly. Mine literally doubled. I remember the day it happened. I was eating one big ribeye a day, and then all of a sudden the next day and it was normally in the evening when I wanted this. And then the next day I woke up and I was like, I'm actually pretty hungry. Steak sounds good right now. So I cooked another steak, ate that, and then did all my stuff for the day. That night I was like, yeah, I want another steak, and I had my normal steaks. And after that, it was 2 steaks a day. That was just it. So it was literally just doubled overnight. If I'm sedentary, just going back and forth to the hospital or to the my clinic, seeing patients, then I may not be hungry more than once a day now. If I'm working out a lot and lifting weights, etc. When I was playing rugby and so on, that I would definitely be hungrier more than that. My appetite would double again. So you just listen to your body, eat fatty meat until it stops tasting good, get the cheaper cut so you can afford it, and don't run out of food that way. It is typically going to be cheaper unless you're buying stupid expensive cuts, which you don't need to do, and doesn't have to be all grass fed and finished and panda massaged, as Dr. Berry says. It just needs to be meat, fatty meat, right? And so lettuce and spinach are typically more expensive per pound than most cuts of steak are. So, you still should be, saving money. I mean, yeah, pastas and rice are cheap. That's pretty cheap, but meat can be quite inexpensive as well if you do it right. So, just keep an eye on that, and make sure you're getting enough fat. Don't buy into this whole nonsense about going super lean on a carnivore diet, because you will get rapid unhealthy weight loss, because you can actually get protein poisoning, and that's actually bad for you. That is damaging to your health. So please don't do that. I've seen people get very sick from that. They can lose their hair. They can have horrible energy. Can screw up their sleep and all sorts of other things. So it's really bad for you. So don't do that. People say, "Oh, you can't blame this on doing carnivore wrong." And they say, "Yeah, you can. Yeah, you can absolutely do it wrong. If you're eating a whole bunch of dairy, artificial sweeteners, you will gain weight, or you will prevent yourself from losing weight. If you're eating low-fat carnivore and you're just eating meat, and you're not eating carbs or anything like that, and you're just getting the majority of your energy from protein, you can get protein poisoning. People have died from that. And so, yes, you can absolutely do things wrong. And people are saying, well, people are with carnivore and ketosis, they're getting these problems, they're losing their hair, they're doing this, they're getting low energy and blah, 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 blah. Yeah, all of those things can be from protein poisoning. And you can actually start getting higher blood sugar as well, because especially for some people, because some people have a big trigger, like protein can actually trigger glucagon, which pushes gluconeogenesis. They get an inordinately high glucagon response from eating protein. Now, if you're basically only eating protein, then you're going to get an even higher response. Your blood sugar is actually going to go up. And they're like, well, wait, hold on a second. I'm ketogenic and all these sorts of things. Like, yeah, but you're screwing with your body and you're screwing with your physiology. So don't do that. Don't fall into that. You can absolutely do things wrong. You can do anything wrong. You can work out wrong, and you can destroy your joints. You can do some stupid plyometrics and blow out your Achilles tendon. That's why you don't do that. And you do things properly with the right technique. So you do carnivore with the right technique too. And that means high fat, and cut out everything else, and you'll do great. Here's a quick one from Michelle 5057, who says, is carnivore diet suitable for someone with Barrett's esophagus? That's a precancerous state where you get sort of these histological changes to lower esophagus. Yes, absolutely. It's appropriate for everybody in all situations. Why is that? Because it's just optimal nutrition. So optimal nutrition is always appropriate for everybody in every situation. So if a lion has, some sort of issue, is meat suitable for them? Yes, it is. Is the appropriate, it's biologically appropriate, as Dr. Berry says, the proper human diet, is the proper human diet suitable for someone with Barrett's esophagus? Well, if you're human, then yes, the proper human diet is appropriate. It may sound a bit flippant, but it is true that this is optimal nutrition. This is just the nutrients that your body needs. It's not going to cause harm just to get nutrients. Meat does not have anything that's harmful to you. And in fact, doing carnivore eliminates out things that can be harmful to you. Now, does that mean that it's going to completely reverse your Barrett's esophagus? No one can say that or predict that, but some people have. But that's not what this is for. This is just to give you the nutrients your body needs and allow your body to heal as best that it can. And if you need medical interventions or help, then that's fine. But this is just to give you optimal nutrition so that your body can just work as well as it can. and you're eliminating out things that can cause harm. That's a big one, that you're cutting out things that hurt you and hurt your body. And so yes, it's definitely appropriate. Hey, come on, stop. Spaz cat. Elle got a new kitten, and so you got a little baby. Again, it's one of those little mutant cats with the stubby arms. Poor little thing. I don't think that's nice. Cats are so graceful and athletic, and lithe and agile, and now you're just stumping their arms. So that's like the best part about being a cat, is having that athleticism and these poor little things. I mean, they're still pretty agile, but it does limit them having little stumpy arms. So, but they're very sweet, very nice little cats. Okay. Here's a question from one of the YouTube members. Thank you very much for joining the YouTube membership, by the way. And it's good to see you here. So Rosa Maria says, I tried a vegan blend that was sent to me by the brand, and I was sick for 3 days. I'm so sorry to hear that. My body reacted like I had food poisoning. Seems to be a solid formula. We definitely don't need plants. No, I'm definitely with you on that. I'm so sorry that you got sick. That's awful. Super chat from Letty Gonzalez. Thank you so much for that. I'm not seeing this. Okay, there we go. Okay, so there's a question here. What do you do with neuropathy pain? Well, there's a lot of things that can cause neuropathy pain. It's sort of just nerve pain. It can be from a compression. It can be from inflammation. It can be from some sort of chemical irritant that's getting into your body. It can be from B vitamin abnormalities. Low B vitamins can cause demyelination or damage to the nerves. High B vitamins, excessive amounts of B vitamins can cause some neuropathies and pins and needles and things like that. So it depends on what's causing it first and foremost, but and then it's just sort of looking at what is the cause of it. So if it's like a compression in your spine, some people get surgery for that, and that doesn't always help, but it can help in some, and it can at least relieve that pressure so that it doesn't get worse. That's sort of the idea, but it can actually help in a lot of cases. So it depends on the neuropathy pain, but I've seen more and more people go on a ketogenic carnivore diet that improve neuropathy pains. And I think a major reason for that, one, you're removing things that cause a lot of inflammation. And so anytime you have a bit of damage in your body, excessive amounts of inflammation will increase pain, or it typically does. And so you're reducing inflammation by reducing the amount of inflammatory things that get in your body, but also you're reducing, because being in ketosis raises ketones, funny enough, and those ketones will actually lower inflammation internally. So ketones block something called the NLRP3 inflammasome, which starts a cytokine cascade, an inflammatory cascade, and then causes increased inflammation and pain. And so ketones stop that from happening in the first place. So that can improve things. But I think most importantly, it provides you with the nutrients, the vitamins and minerals, proteins and fats that you require to repair nerve damage, specifically all damage, but specifically nerve damage. Most people are deficient in these things. Most people are deficient in B12. Not that they know it, it's in the normal reference range, but that reference range is a deficient reference range, because oftentimes this goes down to 150, 200 picomoles per liter. Often below 150 is considered a deficiency, but Oxford University published in 2008 a study that actually showed that under 500 actually caused demyelination and nerve damage itself, and caused people's brains to shrink by 2.5% after 5 years. Okay, so that's not good. And under 300, their brains are shrinking by 5.5% in 5 years. So really bad. And so you need B12 to repair the myelin sheath around the nerves and the white matter in your brains. So without enough B12, you can't regrow that. And if you have so low B12, like under 500, that you're actually getting demyelination, well, then you're really never going to regrow those nerves. And that's why I think that we have historically seen very slow regrowth and very poor recovery from neurological issues. When you say, look, this is just your life now. May get better, but if it doesn't in a year, that's it pretty much. And yet I'm seeing people 30 years after a stroke improving their motor scores. Dave Mack, who was on my podcast, and he has his own podcast. He had a stroke when he was 19, and he had weakness on his right side for the next 30 years. And then he went carnivore, and within months, his motor score, his strength started to improve. It's not 100%, but it's a lot better than it was, and it allows him to be have a normal life and not limp and have a hard time getting around like he used to. So that's pretty cool. So you're getting enough B12, D3, DHA, EPA, choline, creatine, carnitine, and even saturated fat and cholesterol. Are all things that are essential for the brain. They are essential building blocks that you have to have, or else you won't be able to maintain or repair your brain and nervous system. So I think that's a major benefit of being on a ketogenic, high-fat ketogenic carnivore diet and optimizing all these nutrients and getting your B12 up, getting your vitamin D up, and so on. So that's so that is what I would do. And then, of course, there are other reasons. There could be compressions, there could be medical issues that could be contributing to this. Your B vitamins are all screwed up. Eating proper diet that has an appropriate amount of B vitamins should help with that. So there's neuropathic pain from diabetes, right? Because you're damaging the blood supply throughout your body, and that damages the nerves and all the different tissues that blood supplies, which is all your tissues. And so you can get neuropathy because of that, diabetic neuropathy. And some people can heal from that. I have seen that. There is such a thing as damage done. And so if you've had permanent damage to these nerves, that you may not, even with all the nutrients and anti-inflammatory effects of this diet, you may not be able to relieve all of them. But I am seeing more and more really miraculous benefits and results. And it can go slow because nerves are slow growing. But, just give it a shot and see how you go, and, just hope for the best. And at least you're putting your body into a position that at least it has everything it needs, and hopefully it'll be able to heal. So good luck with that. Okay, so we're going to probably stop the super chats now, unfortunately, because I have limited time today. Unfortunately, probably only have to 45 minutes, hour sort of thing. But I'll do all these that I can. So Duke of Hex, thank you so much for the super chat. Hey, Doc, Hilos from California. Great to see you. What is your experience with carnivore effects on autoimmune disorders like ankylosing spondylitis? Thanks. I actually have a number of patients with ankylosing, and it helps. You have to be strict. All autoimmune issues do best with just red meat and water. Watch my video on, it's a lecture on Low Carb Down Under website. I didn't really need to publish it on my channel, but it's called Rethinking Autoimmune Disease. And it's just basically arguing that autoimmune disease is not autoimmune disease. And all autoimmune conditions that I have seen improve dramatically on a very strict carnivore diet, ketogenic carnivore diet. And most benefits come from just eating red meat and water, because the ruminant animals filter out all the toxins and garbage, even glyphosate apparently, from the food that they're eating. So it's a better filter for you, so you're not getting into your body and causing harm. So yes, I've absolutely seen that help with Ankspawn and other sorts of things that have caused damage. That damage will persist, but at least it will stop further damage from occurring and reduce the inflammation and a lot of the pain. So a lot of my patients, just cleaning up their diet massively helps with their symptoms. And by going really strict, it helps even more, dramatically more. So yeah, I would definitely give that a shot and see how you go. I'm sure you'll do. I'm sure you'll do really well. So good luck with that. You'll always do best on just red meat and water. Really need to cut out coffee. I know, but it's very pro-inflammatory. Has a ton of lectins that can kick off autoimmunity. Dairy, unfortunately, is going to cause harm for most people with autoimmune issues, and even eggs, especially egg whites. So I would just cut down to beef, lamb, and water. Beef, lamb, goat, venison, the ruminant animals. I would just eat that, only drink water for at least a few months and see how you go. And then maybe start adding things in if you want to, but I would pretty much stick to just the red meat and water. You'll always do best with that. And so if you're not getting as good of results as you want, just look at your life and say, is there anything in here, tea, whatever, that you're including that is not red meat and water? If it is, cut it out and see how you go. And I'm sure you'll do great. It's a super chat from Stefano, very generous super chat from Stefano. Thank you so much. I really appreciate it. Stefano says, I've developed a slight stomach hernia and chronic gastritis. I find the carnivore diet removes the symptoms. Any thoughts? Thank you. So chronic gastritis, absolutely. That's going to come from irritation to the stomach for a number of different reasons. Often it's from removing the natural protections that your stomach has towards its own stomach acid. So things like NSAIDs and other sorts of things can reduce the prostaglandins in your stomach that are there to protect your stomach. So a lot of times you're removing a lot of those things, and often you don't need as many NSAIDs because you don't have as much inflammation, so you don't need to take those things. But it's not just NSAIDs. There's a lot of plants and plant toxins that can have that effect and lower the protection from your stomach. Also, when you're ketogenic, you have a normal production of stomach acid. So when you're eating carbohydrates, that raises insulin. Higher insulin can increase the acidity of your stomach and cause more damage to your stomach, cause more gastritis. That's why you put people on proton pump inhibitors, PPIs, in order to sort of reduce that the acidity. But if you are just eating meat and water and being ketogenic, you'll make a normal amount of stomach acid in any case. So that's something that a lot of people are experiencing as well, that their gastritis and your chronic sort of reflux and things like that are really improving. So the stomach hernia, I was probably talking about a hiatus hernia, which sort of slips back up through the diaphragm. And those can be quite painful and cause a lot of reflux issues just from that structural difference. It doesn't it allows things to come back up the esophagus a bit more, and it causes more irritation. And so that's really good that has improved, and it could potentially be something along that you're getting a bit more protection. You're not having as aggressive stomach acid and those sorts of things. And I have seen that as well. It's not going to fix the hernia. I've never heard of that. I've seen a lot of people improve their symptoms of a hiatus hernia before. You would have to get a scan basically to see if it actually sort of repaired it. I've seen one person that had a abdominal hernia, like an inguinal hernia, and there's sort of the lower abdomen. He said that his actually healed up, which is the only time I've ever heard that. I haven't heard of anybody else doing that. Maybe someone else has had that experience too. Maybe sort of comment on that in the chat. But that's the only time I ever heard of that. So I wouldn't expect structural defects like that to really heal. I have seen people who anecdotally have improved their diverticulitis. So they had diverticulitis in their colon on a colonoscopy. And then, went carnivore, and a few years later had a colonoscopy again, and their doctor said, yeah, you have no diverticulitis, it's squeaky clean. You don't need to come in for another 10 years. And so that's great. So strange things have happened. I would be less optimistic about structural defects just repairing themselves, but you never know. And the main thing is what are your symptoms? How are you feeling? And if you're doing great, then that's the most important thing. So that's really good. And I'm glad to hear that you're doing so well. Next question is from Josie Makowski. Thank you so much for the super chat. Explain detox online diets for I'm assuming fibromyalgia and lupus. Well, a detox just comes from not eating toxins, and plants have toxins. And so you do a juice cleanse. You're not really cleansing. You're just not eating all the other stuff that maybe were even more harmful than all the garbage that came in the juice. So you're just eating meat. You're only getting nutrients, and you're not getting anything else that your body has to detox. So your body's able to have time to get rid of all these other things that are causing harm. So that's sort of it. Your body will just detox anyway. So for fibromyalgia has a strong association with low taurine. Taurine is not considered an essential nutrient or protein, and yet a lot of studies show that more taurine in the diet, either by supplements or just eating more meat, because taurine just comes from meat, that can improve health outcomes. Well, one of the things is that you make taurine, but you make it in a certain way. You make it in your liver, it's expelled in your bile, and then you reabsorb that when you eat fat. And so if you're avoiding fat like crazy, you're not necessarily going to reabsorb all the protein or all the bile, and you're not going to get all the taurine with that. But also when people eat fiber, and we're told eat more fiber, eat more fiber. Well, fiber actually is an anti-nutrient, and it binds to bile and eliminates it. So now you get malabsorption of fats and fat-soluble nutrients and taurine, because if you're eliminating the bile, the taurine goes with it. And so that can trigger off fibromyalgia. So I know pain specialists who actually use carnivore diets to treat their chronic pain patients. And for fibromyalgia specifically, that's part of their treatment profile program, is to actually put them on like 4.5 grams of taurine as a supplement. When you're eating more meat and you're not eating fiber, you're going to get more taurine, especially if you don't overcook the meat, because that can denature taurine, or will denature taurine to a point. And so that can help for fibromyalgia potentially. I've seen a lot of people with very debilitating fibromyalgia who have actually put it into remission, which is amazing. And some of these people were very, very unwell, and it's really sad, but they were so much better. And they were actually in tears telling me about this at a conference. A lady brought her whole family to meet me just because she was like, I have to meet this guy because this changed my life. And it was really, really, really touching. And it was so nice to see get her life back, which was really nice. So that I've seen that definitely help. Can't say it's going to help everybody in every situation, but it seems to help a lot of people. And I have a video on chronic pain and fibromyalgia, and videos, I mean, watch it if you want, but the main thing is the comments. I mean, there's thousands of comments on there of people improving their chronic pain issues by doing this. It's amazing to see. And some of these people are saying they were on opiates for 12 years, and then 1 month later they were able to come off of them, and they're just so relieved, which is great. It's really great to see. For lupus is an autoimmune issue, and all autoimmune issues that I've seen, including lupus, and I have a number of patients who had lupus, when they are strict carnivore, especially if they're just eating red meat and water, it improves. And so it's detoxing from plants and glyphosates and things like that are causing the lupus. So really you just need to eliminate these things out of your body, and your body will do that. Your body will get rid of this stuff. And you just can't bring it in. And so best option is to do just red meat and water, beef, lamb, and water, goat if you can get it. And that's all. You're always going to have the best outcome with autoimmunity, with the ruminant meat and water. So good luck with that. Hopefully that helps, and hopefully you do really well. I'm sure you will. So work. Thank you so much for the super chat. Saw your Costco haul. Do you store meat fully seasoned, open in the fridge to age? What are the benefits of your approach? I buy big packs of the big Cryovac primal cuts, ribeye, New York strip, briskets, things like that. I keep it in the Cryovac pack, chuck, those sorts of things. Keep it in the Cryovac pack in the refrigerator. As long as that seal isn't broken, there's no air getting in, that will wet age. And so that's what wet aging is. And you can leave that in there, typically up to a month is pretty safe for beef. Don't try that with pork. I did that. That was a bad idea. 2 weeks, it was it's god awful. So, but beef does pretty well. Has to be in the fridge, and it has to be no break in the seal. I've gone as far as 6 weeks, but I wouldn't really recommend that. That was fine for me, but you're sort of getting a bit long at that point. But many restaurants will do that. If they do it properly, they can do it for 30 days pretty much without a problem. So they do like a 30-day wet age, 30-day dry age. You'll see that on there. Some $200 steak or something like that. With 30-day wet age, 30-day dry age, that's the wet aging part of that. But in the fridge. Then when I open them up, I'll cut them up into big, thick steaks. I used to salt them. Now I don't really. But if you want to salt, that's the time to salt them. And then you put them on a drying rack, on a metal wire rack. so that air is circulating around all sides. It can't touch anything because any area of moisture will grow bacteria. Lack of bacteria can't grow without moisture. So this is why we use alcohol to disinfect things in the hospital, because that desiccates things, dries it out really well. Bacteria can't grow and function. But they can come back, because once you get moisture again, they'll sort of flush up again, and they'll come back. And so if you have sort of dries out and you sort of have this area and it sort of starts touching, it sort of gets a bit moist, then you can start growing bacteria again. So just be careful with that. And that just dries it out. I mean, that's really the main thing. The benefits are it takes out the excess water and it concentrates the beef and the beef flavor. So it tastes better. It tastes more beefy. And that salt goes all the way through it if you're salting it, and that kind of tastes nice too. But the drying is really nice too. And when you cut it into steaks, it dries faster. There's more surface area to volume, right? And so if you're doing a whole big ribeye and you're drying aging that, it takes a lot longer for the inside of that to dry out. So if you're just cutting up into steaks, it dries out much quicker. You get more of that dry age effect, and it tastes nice. And so that's your sort of meal prep. I've got a bunch of steaks in the fridge now, just all cut up and just sitting there, and I just take a couple out every day. And as it dries, it sort of gets better crust and sort of more crispy and bubbly and browns better. And so it just tastes better too. I mean, even just doing that overnight tastes better than just throwing it in there from the from the grocery store. So yeah, those are the benefits. Okay, so Overease 72, thank you very much for the super chat. I've been strict carnivore, beef, water, salt only for 3 months to heal seborrheic dermatitis. It got worse at first and still isn't great. I'm committed to a full year, but it's discouraging. I'm really sorry to hear that. Yeah, sometimes things do get worse. There are a lot of people that have healed that. So, I think it is a good idea to stay the course. Maybe look at other things that might be contributing, anything you're putting on your skin, different shampoos and soaps and things like that. Anything on your skin, anything dermatological, you have to think about the things that you're putting on your skin, not just in your body as well. So I would not use any sort of weird creams and this and that's and medication, fine, but as far as like moisturizer is concerned, they are just full of just chemical nonsense, and I would just stay far away from those. If you're going to use any sort of moisturizer, I would use tallow or emu oil, and just think about anything else that might be getting into your system or on your skin that could be causing a problem. Just get away from it. And hopefully you're getting other benefits as well. So remember to not lose sight of the other sorts of benefits that you might be getting. Don't lose sight of the forest for the trees. If you're very focused on just the dermatitis, you may miss all these other benefits that you're getting and to your health. And so while this is your main purpose for doing this, just remember that you're getting other benefits as well. And it's really important to keep track of that and be mindful of that, because it can be worth it. Even if your skin never heals, you can be so much healthier in so many other ways that it would still be well worth doing this. But odds are that this is going to heal. There's so many people that have healed this, but it does take time. And sometimes, like you say, it can get worse before it gets better. So you're doing a great job. Committing to a full year is really, really good. It should sort itself out by then, but don't lose sight of all the other benefits that you're getting too, because those are worth it too. Okay, so Joseph 38368, thank you very much for the super chat. Have you seen the carnivore diet have positive effects on patients with long COVID? I have, but it's not an area that I am heavily involved in. I have definitely spoken to people that over the course of months they improved long COVID. I've had some patients who have reported that as well. I know another doctor who was actually talking about joining my practice, that he deals a lot with that, and he uses a carnivore diet approach as well. He might use, I think he uses other things as well, like the Dr. Peter McCullough protocol for clearing out the spike proteins and things like that. And from what I remember him saying, it sounded like it was, it was beneficial. So yes, I have heard of people with long COVID doing better on carnivore. Was that just because their body was going to get over it anyway, or was it because their body was you're healing a bit more from the carnivore? And I can't say. We don't have randomized controlled trials that can tell us one way or the other. But people are reporting that this can help, but it can take a long time. I would think about those protocols like from Peter McCullough about, and these are published protocols, like in peer-reviewed literature. So it's I think that it might be something worth trying anyway. And you don't have to do it forever, but trying it for a few weeks or a month or two or something like that, and see if that helps, and see how you go. So hopefully that does, and good luck with that. I hope you feel better soon. Okay, so H Shirley 96, thank you so much for the super chat. I really appreciate it. Doc said gallbladder is 30%. Said to not eat high-fat foods. Said gallbladder will eventually come out because it can't get better. Can gallbladders actually be healed, and can I eat fatty foods? Yes and yes. If you don't eat fat, then your gallbladder will definitely come out, because bile goes into your gallbladder and it gets stored there for when you eat fat. If you don't eat fat, it doesn't come out, and it can concentrate, and it does concentrate. And this is in the gastro textbooks, the physiology textbooks. It will concentrate, and normally concentrates up to 20 times as concentrated as it comes out of your liver. And that's because you need fat, and so your body is storing that bile so that if you don't get fat every day, you can absorb all the fat you need for the week in one go. So if you don't eat fat, you will get gallstones, right? Or you increase your risk of getting gallstones. If you do eat fat and you eat enough fat so that you use up all your bile, you cannot get gallstones. Now, some people aren't going to get gallstones even if they don't eat fat. So maybe their body is concentrating up to 20, but not further. Maybe some people concentrate up to 30, 40, 50. And what does any hyper-concentrated solution do at rest? It forms precipitate. It forms crystals. That's bile sludge. Those are gallstones. So if you eat fat and you have gallstones already, which it sounds like you do, there's a risk that those gallstones can get stuck, and you may need an emergency procedure. You may need emergency surgery or like an ERCP, where they snake up a tube down your throat and up the bile duct and have to snake that sucker out. So that can do that. But some people, if they're small enough, they pass them out. Some people actually do dissolve them. I actually have patients who are actively dissolving them. Some are like 4-centimeter stones that are just massive. So it's too big to get stuck, really. But it's not, she's not like in acute cholecystitis or anything like that. So she's just, and so she's delaying her surgery because after 2-3 months, her it actually shrank by 3-4 millimeters. Okay. So what's going to happen? You're sort of you're moving this bile through because you're eating high fat, and that can actually start to sort of dissolve this thing, and it starts to elute out, some of the bile. So, and who knows, maybe that's like a protective mechanism where it forms little sludge and bile where it's just super concentrated because you're just not eating enough fat. And then even months down the road, you may be able to catch up for the fat that your body actually wanted months ago. Who knows? But either way, if you don't eat fat, those gallstones will get worse. I mean, that's a given. So your doctor's saying that eventually this will have to come out. And if you follow his advice, he's right. If you don't follow his advice and you do eat fatty foods, you do risk getting one of those stones stuck. You're at risk of that now anyway. But just remember that at any point, those stones can get stuck, whether you eat fat or you don't. If you're eating fat and sort of squishing these things out, it can be a bit uncomfortable. And yes, those stones could get caught. And so you need to know the signs and the symptoms that if this gets blocked or something happens, you need to go into the hospital. You need to go to your doctor, and you might need emergency surgery. You might need emergency surgery anyway. But that is a risk. Some people have cleared their gallstones. And again, my patient has massive gallstone, and it is shrinking. Now, it might shrink down to the point that it can actually get loose and then get stuck and she needs surgery anyway. but this is what she wants to do, and so that's what she's trying. So that's how that works. And now you have a more informed choice and more information, so you can make an informed decision on what you want to do. So good luck with that. I hope that you do well, and I hope that you don't have to get surgery, emergency, or otherwise. And good luck with that. So Tia Ferry, looks like there's a chat down here. They say, can carnivore help with Sjogren's syndrome? Thank you. Yeah, that's another autoimmune issue. And again, all autoimmune issues I've ever seen improve dramatically on a carnivore diet. So yes, and I actually do have some patients with Sjogren's who have responded really well to that too. So, and if you have one autoimmune condition, you almost always have multiple autoimmune conditions. And so Sjogren's is like that too. It's generally associated with things like lupus and others. And they all get better. It's the same treatment for everything. Just get rid of the things that are triggering the autoimmunity. And it's a pretty good way of preventing autoimmunity. This will be the last one. This is the last super chat that we have. So thank you all very much for that. Jay Blaze, thank you so much for the super chat. I appreciate it. You've helped me a lot. Thank you. Does undercooking ground beef cause diarrhea? Also, any recommendations on certain meats to keep potassium up? As far as the potassium is concerned, I don't know offhand, but there are registries online where you can look at different vitamin, mineral, and electrolyte composition per 100 grams or per ounce or whatever for different cuts of meat and different types of meat. And so that might be a good idea. And then organs are generally higher in sort of nutrient density. And so that might be an option too. But I would try to find something online, like a directory online that has that. I don't know offhand for potassium. I just eat meat and drink water, and my potassium is fine. And that's what I see in my patients as well. If you have an actual potassium deficiency or a higher demand for potassium, then that's a good idea, to look into which meats and organs might be more replete with potassium, or if there's something weird going on, just take a potassium supplement. Those sorts of things can be helpful too. Does undercooking beef cause diarrhea? If it's contaminated, potentially, you could get food poisoning or something like that. But if it's fresh ground and it's not contaminated, then it should be fine. Sometimes if you're having a very fatty ground beef, a lot of that fat will render out, and sometimes that's it goes through your system quicker, because if it's in the fat itself or in the fat tissue itself, then it can it's like a sort of a slow release capsule or medication where it just sort of elutes out slowly, and your body has a chance to sort of break it down and absorb it and get the bile out there. Whereas if it's more rendered fat, sometimes that can go through a bit quicker, and then it doesn't get absorbed straight away, and then that can cause loose stools as well. So yeah, potentially, but think about rendered fat, think about the fat content, and I don't ever recommend eating contaminated meat of any form. I know there are people that do eat, high meat is what they call it, to not want to say rotting meat, but it is rotting meat, and some people do that, and they swear by it, and that's good for them. But I don't think you need to do that. You're still going to get all the nutrients that you need just from eating non-rotting meat, and you'd be very, very healthy as a result of that. And so I obviously can't, in all good consciousness or ethically, recommend people eat rotting meat because people can get sick, and then that would be on me that that they got sick. So I can't do that. If people want to do that, and they're making an informed decision, and that's their business. I don't have any any say on that. But I just I can't recommend that, because of the potential harm that it can cause. And so and I don't think you need it. I don't think that there's something that happens when you rot meat or ferment meat that is any better than, or that brings about an essentiality that we have to have. Maybe it makes things more bioavailable. Maybe it makes things a bit slightly more nutritious. It's plenty nutritious already. It's already nutritious enough. So I don't think you have to do that. So hopefully that helps. But yeah, so think about fat, think about the rendered fat, and think about contamination. Obviously, never eat contaminated meat. And but the undercooked part would suggest that something's contaminated. If it's not contaminated, then cooking it less well done is fine. Fresh ground beef is typically fine. I mean, some people eat that raw, once you've let ground beef sit for a while, then the bacteria can sort of build up in it, because if there's bacteria on the surface of a steak, say, you just cook the outside and leave the inside raw. Well, there's no bacteria going in there; it's just on the surface, and it's usually from food handling. And so, just be mindful of that. And then ground beef, if you grind that piece of meat, then that bacteria gets mixed in, but it's still probably pretty low bacterial load. So you could still sort of eat that rare or raw or whatever. But once that's been sitting there for a while, that can increase that bacterial load. And then you sort of want to cook it a bit more well done to deal with the bacteria, or, at least medium rare or medium. But there's a potential there for harm, but most of the time it's fine. Just be mindful of the contamination, and then overcooking meat can render out a lot of the fat, and then that can cause loose stools just from the rendered fat side of things. Okay, I hope that helps, and thank you all. We did a good hour that time. I've got to run, unfortunately. I've got some plans today, so I'm gonna go watch the Melbourne Cup, and so that's the horse races and things like that. So we have plans to go watch that, and thank you all for joining. It was a pleasure, and as always, and I'll be back to doing these regularly every week as much as I can, and for as long as I can, when I can. So thank you all very much. It was great to see you all. Thank you for joining, and we'll see you next time.